Hey everyone, welcome back to all my listeners. Hope you're all having a great day so far. And if it's your first time finding me, thanks so much and welcome. Welcome to episode 11 of my third season. Today is Wednesday, July 14th, 2021. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Now, I'm so glad you've all been enjoying this third season. My numbers have been looking good, and they've actually pushed me up into the top 50 on Apple Podcasts. So thank you. Thank you so much for listening in and subscribing. I really love providing valuable content to the healthcare industry. So keep giving me those 5-star reviews and ratings because all you do is keep me motivated to keep on going. So thank you, Canada. I see you. Happy to join your top charts. I'm staying strong in the Philippines as well, week after week. I'm simply humbled and love the warm welcomes from everyone. Now, today's solo session is simply packed. It's filled with relevant industry news and all my compliance tips. Now, I keep poking into improving hospice compliance. This week, I get into registered nurses, our RNs, maintaining compliance. This episode also highlights the Newsworthy OIG Work Plan for June 2021. And I round out today's episode with a profound note on journeys from the German poet and playwright Goethe. If you've checked me out on LinkedIn, you know I'm all about compliance and protecting our physicians and valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organizations, to want to dive in deeper, to use my tips and best practices to ensure success. I hope this podcast will help you boost the quality of documentation capture and improve coding accuracy as you help your providers paint the medical picture. If you like what you're hearing, go ahead and hit that subscribe button now so you don't miss another episode. Please write in a review and drop me a 5-star rating on Apple Podcasts or wherever you listen to my podcast. I'd really love your support. And as always, a friendly disclaimer. Remember, I'm bringing you the news, current healthcare industry news, my compliance tips and recommendations based on my over 10 years of experience in front office, back end, coding, and billing for multi-specialty physicians, compliance, and auditing for both E&M and surgical operative reports. These are my opinions alone and are not to be construed as legal advice. So, let's get into Newsworthy. I wanted to go over the 12 new June 2021 updates made to the OIG Work Plan. The first is titled National Institutes of Health and Grantee Compliance with Federal Requirements to Ensure Proper Monitoring and Use of Grant Funds by Selected Grantees and Sub-Grantees. Now, this is an audit from the Office of Audit Services. The National Institutes of Health, that's our NIH, is the primary federal agency that conducts and supports medical research. NIH funds grants, cooperative agreements, and contracts that support the advancement of fundamental knowledge about the nature and behavior of living systems. Now, approximately 80% of NIH funding goes to support research grants, including grants and subawards to support research conducted outside of the United States. Now, the OIG has previously identified NIH's oversight of grants to foreign applicants as a potential risk to the department meeting program goals and the appropriate use of federal funds. Now, NIH must manage and administer federal awards to ensure that federal funding is expended and associated programs are implemented in full accordance with statutory and public policy requirements. Now, to do this, the NIH must then monitor grantee performance and grantee use of the NIH funds. Grantees are responsible for complying with all requirements of the federal award, including maintaining effective internal controls over the federal award. And you can find that under 45 CFR, Section 75.300 and Section 75.305. Now, grantees that function as pass-through entities must also monitor the activities of subrecipients, including foreign subrecipients, to ensure that subawards are used for authorized purposes in compliance with relevant laws, as well as terms and conditions of the sub-award. And you can find that in section 45 CFR 75.352. Now, the OIG will review NIH's monitoring of selected grants and grantee use and management of NIH grant funds in accordance with federal requirements. The final report is expected in fiscal year 2022. Now, the second OIG Work Plan update for June 2021 is titled Medicare Payments for Clinical Diagnostic Laboratory Tests in 2020. Now, this is an audit stemming from the Office of Evaluations and Inspections. Of course, Medicare is the largest payer of clinical laboratory services in the nation. Medicare Part B covers most laboratory tests and pays 100% of allowable charges, which means patients do not have a copay. Now, the Protecting Access to Medicare Act of 2014, also called PAMA, requires CMS to set payment rates for laboratory tests using current charges in the private healthcare market under Title 18 of the Social Security Act. Now, on January 1st, 2018, CMS began paying for laboratory tests under this new system mandated by PAMA. PAMA requires OIG to publicly release an annual analysis of the top 25 laboratory tests by expenditures. Now, in accordance with the Social Security Act, the OIG will publicly release an analysis of the top 25 laboratory tests by expenditures for 2020. This final report is expected in fiscal year 2022. And along the same vein, our third OIG Work Plan update for June 2021 is titled Audit of CMS Clinical Laboratory Fee Schedule Rate Setting Process for Public Health Emergencies. This analysis is stemming from the Office of Audit Services. Now, Medicare Part B pays for most clinical diagnostic laboratory tests under the Clinical Laboratory Fee Schedule. As a result of PAMA, beginning in 2018, CMS sets the Clinical Laboratory Fee Schedule, also called the CLFS, reimbursement rates, which are based on the weighted median of the private payer rates that are reported to CMS. Now, a rate is set for each CDLT, which is again that clinical diagnostic laboratory test. Each of those is set through the Healthcare Common Procedure coding system, right? Those are all of our HCPCS codes. Now, the data is reported every 3 years, beginning January 1st, 2017. Now, remember, the reporting was a bit postponed from January 1st, 2020 to January 1st of 2022 because of the pandemic that we're facing. Now, for new CDLTs, CMS or its MACs set the reimbursement rates using crosswalking or gap-filling methodologies. So CMS determines the basis after it solicits and receives public comments and announces and holds its CLFS annual public meeting regarding new CDLTs and considers comments and recommendations, as well as accompanying data that's received, including all recommendations from an outside advisory panel. Now, the objective of this audit is to determine whether CMS's procedures for clinical diagnostic laboratory test rate setting could be improved for future public health emergencies. This final report is expected in fiscal year 2022. Now, the fourth OIG Work Plan update for June 2021 is titled Audit of Independent Organ Procurement Organizations' Organ Acquisition Overhead Costs. Now, this review is from the Office of Audit Services. The OIG will review Medicare payments made to independent organ procurement organizations, or OPOs. Now, an OPO is an organization that performs or coordinates the procurement, preservation, and transport of organs and maintains a system for locating prospective patients for available organs. Now, Medicare reimburses OPOs under 42 CFR Section 413.200 according to a cost basis method, which is laid out for us in 42 CFR Section 413.24. Now, prior OIG audits determined that OPOs did not comply with Medicare requirements for reporting overhead costs and administrative and general costs, and for reporting organ statistics. So the OIG will determine whether payments to OPOs for selected overhead costs complied with Medicare requirements and guidance. This final report is expected in fiscal year 2022. Now, the fifth OIG Work Plan update for June 2021 is titled Office of Refugee Resettlement Influx Care Facilities and Emergency Intake Sites, COVID-19 Protocol and Reporting. This analysis will be conducted by the Office of Audit Services. Now, in response to the increase in the number of unaccompanied children transferred into the custody of the Office of Refugee Resettlement, called the ORR opened temporary facilities known as Influx Care Facilities, or ICF, and Emergency Intake Sites, or EIS. Now, in March 2021, ORR issued new guidelines in consultation with the CDC for safeguarding against COVID-19 in ORR facilities, including guidance for shortening COVID-19 quarantine duration and increasing testing. So the OIG's audit will determine whether the ICF and EIS, which are not state licensed, have procedures in place to promptly identify and treat children coming into care who have COVID-19 and mitigate the spread of this disease in their facilities. Additionally, the OIG will assess the completeness of ICF and EIS facilities' COVID-19 testing data and results reported to ORR and state and local health entities as appropriate. This final report is expected in fiscal year 2021. Now, the sixth OIG Work Plan update for June 2021 is titled Audit of HRSA's Cybersecurity Controls over the Organ Procurement and Transplantation Network. The Office of Audit Services is in charge here. Now, the National Organ Procurement and Transplantation Network, the OPTN, is used to assist our medical professionals involved in U.S. organ donation and transplantation. Now, the OPTN is operated under contract with our HRSA, or Health Resources and Services Administration. Now, the OPTN operates a transplant information database containing national data on the candidate waiting list, organ donation and matching, as well as transplantation. This system is critical in helping organ transplant institutions match waiting candidates with donated organs. So if appropriate cyber controls are not implemented, there may be a significant impact to patients and healthcare providers should there be a cybersecurity incident. The OIG will conduct a penetration test and determine whether HRSA has actually ensured there are adequate cybersecurity controls over OPTN. The final report is expected in fiscal year 2022. Now, the seventh OIG Work Plan update for June 2021 is titled National Institutes of Health's Use of Single Audit Requirements to Enhance Program Integrity. This final report is coming from the Office of Evaluations and Inspections. Now, HHS is the largest grant-making agency in the United States. As part of HHS, the NIH awarded $33.4 billion in grants to over 2,500 external organizations, which are universities, medical schools, hospitals, and other research facilities in fiscal year 2020. Now, external NIH grantees expending $750,000 or more in federal funds per year must conduct an annual audit in accordance with the Single Audit Act and 45 CFR Part 75. Now, these audits provide assurances to the NIH and its grantees that they have adequate internal controls and that they comply with certain program requirements. So NIH must use its grantees' audits to follow up on findings and improve federal program outcomes. Such action will work to protect the integrity of its awards from fraud, waste, and abuse. The OIG will determine the extent to which NIH monitors and uses grantees' audit findings to improve program integrity at both the individual grantee level and across grantees. The final report is expected in fiscal year 2023. Now, the 8th OIG Work Plan update for June 2021 is titled Accuracy of Place of Service Codes on Claims for Medicare Part B Physician Services when beneficiaries are inpatients under Part A. This final report is coming from the Office of Audit Services. Now, generally, Medicare makes payments under Part B for physician services and payments under Part A for the costs of inpatient stays at inpatient facilities, such as skilled nursing facilities, our SNFs, and hospitals. Now, while Medicare pays both SNFs and hospitals through a prospective payment system for the costs of inpatient stays, physician services provided to SNF and hospital inpatients are paid according to the Medicare physician fee schedule. Now, the amount that Medicare pays physician service providers, such as physicians, podiatrists, and nurse practitioners, they can vary based on where the service is provided, such as the SNF, the hospital, or the physician's office. So physician services can include medical and surgical procedures, office visits, and medical consultations. Now, fee schedule payments for physician services are based on 3 major categories of physician costs. Number 1 being practice expenses, number 2 being the physician's work, and number 3 being the malpractice insurance. Now, the practice expense is intended to cover overhead costs involved in providing a service. Now, to account for the different practice expenses that physicians incur at different settings, Medicare designates a non-facility rate and a facility rate for each service within the fee schedule. Now, because physicians generally incur higher practice expenses by performing services in their offices and other non-facility settings, such as independent clinics and urgent care facilities, Medicare generally reimburses physicians at a higher non-facility rate for services performed in these types of settings. So for services performed at a facility setting, such as a SNF or a hospital, Medicare then generally reimburses physicians for services at a lower facility rate, and the prospective payment system payment to the facility covers the overhead expense. So physicians indicate the applicable place of service on a Medicare claim using a 2-digit place of service code, a POS, to ensure that Medicare properly reimburses the physician at either the non-facility rate or the facility rate. The physical setting where a physician performs a service does not always determine the appropriate place of service code. Now, what does that mean? So, for example, when a beneficiary is a registered inpatient at a hospital or a SNF, physician services should always be coded with a facility place of service code and paid at the facility rate. This is irrespective of the setting where the patient actually receives the face-to-face encounter. Now, OIG's preliminary data analysis indicates that during 2018 and 2019, Medicare may have paid a significant number of Part B physician service claim lines at the non-facility rate when the patient was a Part A inpatient at either a hospital or a SNF. So the OIG will determine whether Medicare appropriately paid claims for Part B physician services based on the correct place of service code when a patient was an inpatient at a SNF or a hospital. This final report is expected in fiscal year 2022. Now, the ninth OIG Work Plan update for June 2021 is titled Audit of Medicaid Applied Behavior Analysis for Children Diagnosed with Autism. This final report is being conducted by the Office of Audit Services. Now, autism spectrum disorder is a developmental disability that can cause significant social, communication, and behavioral challenges for children. So, according to the CDC, there is currently no cure for autism. However, research has shown that early intervention and treatment can improve a child's development. A common treatment for autism is applied behavioral analysis, or ABA. ABA can help an autistic child improve social interaction, learn new skills, maintain positive behaviors, and minimize negative behaviors. Now, over the past few years, some federal and state agencies have identified questionable billing patterns by some ABA providers, as well as federal and state payments to those providers for unallowable services. So the OIG will audit Medicaid claims for ABA services provided to children diagnosed with autism to determine whether a state Medicaid agency's ABA payments complied with federal and state requirements. The final report is expected in fiscal year 2022. Now, these upcoming next 3 work plan items are all related. The 10th OIG Work Plan update for June 2021 is titled Safe and Efficient Release of Unaccompanied Children to Sponsors. The Office of Evaluations and Inspections is conducting this report. Now, our Office of Refugee Resettlement, our ORR, experienced a surge of unaccompanied children in the spring of 2021. And as a result of this surge, ORR experienced difficulties in increasing its capacity to care for unaccompanied children. ORR-funded facilities also face challenges in recruiting and retaining staff. The need to release unaccompanied children to fully vetted sponsors during a surge may have created vulnerabilities that could have put the children's safety at risk. So, to address this main concern, the OIG will conduct an evaluation of the implementation and efficiency of ORR's sponsor screening and follow-up processes at facilities during this surge, including the newly established intake and influx centers. So, this evaluation will determine to what extent, number 1, proper steps were taken to safely release unaccompanied children to sponsors, and number 2, if these processes were completed in an efficient manner. This final report is expected in fiscal year 2022. Now, the 11th OIG Work Plan update for June 2021 is titled Office of Refugee Resettlement Influx Care Facilities and Emergency Intake Sites, Employee and Staff Background Screening. The Office of Audit Services is conducting this report. Now, to address the number of unaccompanied children arriving at the southern border and being referred into the Administration for Children and Families, Office of Refugee Resettlement, that's the ORR's custody and care, the ORR has opened temporary influx care facilities, the ICF, and emergency intake sites, the EIS, that are not state licensed. Now, back in March of 2021, ORR issued waivers for certain background checks for employees, staff, and volunteers at some of its ICF and EIS due to the impossibility or impracticability of obtaining the background check results in a timely manner. Now, this OIG audit will determine whether these facilities are conducting the background checks that are still required before employees are hired and are implementing mitigation strategies to ensure the safety and well-being of children, especially if ORR permitted employees to have direct access to children before those background checks were in fact completed. The final report is expected in fiscal year 2022. Now, the final OIG Work Plan update, the 12th and final OIG Work Plan update for June 2021 is titled Office of Refugee Resettlement Influx Care Facilities and Emergency Intake Sites, COVID-19 Protocol and Reporting. The Office of Audit Services is conducting this report. Now, in response to the increase in the number of unaccompanied children transferred into the ORR opened temporary facilities, known as our ICF and EIS. Now, back in March 2021, of course, the ORR had to issue new guidelines in consultation with the CDC for safeguarding against COVID-19 in ORR facilities, including guidance for shortening COVID-19 quarantine duration and increasing testing. This OIG audit will then determine whether the ICF and EIS, which are not state licensed, have procedures in place to promptly identify and treat children coming into care who have COVID-19 and mitigate the spread of the disease in their facilities. Additionally, the OIG will assess the completeness of ICF and EIS facilities' COVID-19 testing data and results reported to ORR and state and local health entities as appropriate. This final report is expected in fiscal year 2021. Wow. So the OIG never tire, do they? They're always working on a myriad of audits and inspections, despite this lengthy public state of emergency we're all enduring. Now, you can see the similar threads in these 12 work plan items, right? From 2 of them regarding the NIH grants issued to selected grantees and subgrantees, and 2 of the updates regarding the organ procurements and transplants, as well as 2 updates regarding reimbursements for clinical diagnostic labs. But I really want my eyes peeled on the final report for the accuracy of place of service for our Part B providers when in fact patients are in the hospital or inpatient setting. So in my opinion, I always pass this critical information on to my providers who need it to review their coding and billing practices or their overarching compliance programs. I think these reports with findings are always most interesting and informative, and I always look forward to analyzing them in the years ahead. It's also important for my listeners to pay close attention to these monthly OIG Work Plan updates to see how they may impact you, your provider, or your health system. And now, it's time for my best practice tips in Trusty Tip. Now, I've been slowly poking at maintaining compliance in the hospice setting in multiple episodes in seasons 1 and 2, and of course, as recent as my Smirk Audit series in this 3rd season. Why am I poking? I know firsthand that hospice is a hotbed of recent post-payment audits that creep up to the tens of thousands of dollars for each claim. So I truly believe increased attention on education is critical. I'm unpacking some compliance education today for our registered nurses, our RNs, in the hospice setting. Now, an OIG report from November 2019 is literally titled, quote, "Registered nurses did not always visit Medicare beneficiaries' homes at least once every 14 days to assess the quality of care and services provided by hospice aides," end quote. So I'm going to outline facts that these types of RN visits must be performed, and they must be documented by RNs as well. So the role of the RN is also predominant in the supervision of hospice aid services, alongside the work of the RN that is independent and individualized. That means, generally speaking, the RN responsible for supervising the hospice aid is the RN responsible for the patient's nursing care. The role of the RN responsible for supervision is to assess the adequacy of the hospice aid services in relationship to the needs of the patient and family based on the plan of care established by the interdisciplinary group, the IDG. Now, the hospice RN supervisory visits are only required for patients who are getting hospice aid services as a part of their plan of care. Hospice aid supervision ensures that aides are, number one, following the patient's plan of care for completion of tasks assigned to the hospice aide by the RN. Number two, they must be creating a successful interpersonal relationship with the patient and family that supports compassionate care. Third, they also must be demonstrating competency with assigned tasks. Fourth, they must be complying with infection prevention and control policies and procedures. Fifth, they must be reporting changes in the patient's condition. And finally, sixth, they must be honoring the rights of the patient. Now, the hospice has responsibility to these RN supervision visits, right? Right. So the hospice is responsible for ensuring that the supervisory RN makes an on-site visit to the patient's home no less frequently than every 14 days. So this in-person visit by the supervising RN to interview the patient and or caregiver ensures that the hospice gives safe and appropriate services. Medicare requires the 14-day RN supervisory on-site visit when Medicare identifies aid services as part of the plan of care and does not require the presence or direct observation of the hospice aide. Now, if the RN becomes aware of an area of concern during the 14-day on-site visit, the RN will conduct a separate on-site visit at the patient's home to observe and assess the aide performing care. And if the RN identifies a performance concern during this visit, the hospice aide must complete a competency evaluation based on the aide's skills that the RN identifies as being deficient. Now, here's a big tip from me. If the patient's plan of care includes hospice aid services and the RN makes a supervisory visit, let's say on a Thursday, the next supervisory visit is due not later than the Thursday that occurs 14 calendar days later. This would include appropriate documentation of the on-site visit as well, with any relevant findings. But an even bigger and better tip, proactive planning is critical to meeting this requirement, right? The supervisory visit should occur before 14 days to avoid falling out of compliance. This applies to both the 14-day on-site visit and the annual on-site visit. Now, the hospice is also responsible for the annual on-site RN supervisory visit. Specifically, the hospice is responsible for ensuring that the supervisory RN makes an annual on-site visit to the location where a patient is getting care to observe and assess each aide while the aide is performing care. This ensures that at least one in-person direct care observation occurs annually for each hospice aide. Now, when it comes to documentation, yep, that's right. The hospice is responsible for the RN's documentation of those supervisory visits at 14-day and annual. The hospice is responsible for ensuring documentation in the clinical record that the RN conducted the 14-day on-site RN supervisory visit. This includes appropriate documentation of the on-site visit and any relevant findings or concerns. If the RN identifies areas of concern, the clinical record should also indicate that the direct on-site supervision of the hospice aide took place during the next home visit by the aide, in addition to any additional findings or related follow-up training. Now, the supervisory RN should document the annual on-site RN visit in accordance with the hospice's own policies and procedures for monitoring and tracking. The annual on-site supervisory RN visit documentation should indicate the aide's ability to demonstrate performance in following the patient's plan of care, demonstrating competency with assigned tasks, complying with infection control policies and procedures, reporting changes in a patient's condition, and creating successful relationships with the patient and the family. These requirements also help the hospice provider by ensuring that the hospice addresses concerns raised by the patient and their family or caregiver in a timely manner. So it's important that hospice providers have an identified system in place for monitoring plans of care to ease the tracking and completion of RN supervisory visits for hospice aid services. To help the tracking of these supervisory visits, a hospice may consider incorporating a review of these visits into the discussion at each IDG meeting. Additionally, hospices may include supervisory elements with every nurse visit assessment, including documentation regarding the aide's care and compliance with the care plan to ensure the hospice gives adequate supervision. It's clear workflows and efficiencies can always use improvements, and updates to compliance programs are a must. So, a better, smarter approach is one that's proactive and starts by painting a clear, rich, and vibrant medical picture the first time, so your certified medical coder can then abstract codes with accuracy. And finally, in this week's inspiring quote in Spark is from the great 18th century German playwright, poet, and novelist, Johann Wolfgang von Goethe. Whatever you do or dream you can, begin it. Boldness has genius and power and magic in it. So very true, right? I think this is a remarkable reminder on beginning. Just begin. And I agree wholeheartedly. What on earth are we waiting for? No one is going to give you permission to take that first step. It is you who must take that first step, that first bold step into your journey. We must all begin somewhere and keep going. Bumps and all, forks in the road, everything. We will never know just how far we can soar if we sit it out, if we don't take a chance. No one can take that chance for us. So I always believe absolutely anything is possible. I'm happy Goethe's spark still shines on in all of us today. So that wraps up today's episode. Please go out and make this a great day, an incredible week for yourselves. Aim a little higher, do a little more, and give back in any way you can in 2021. There's so much each one of us can do. And as always, I appreciate you diving into today with me. And if you want more information from me, go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. Please continue staying safe and healthy, but enjoy your summertime too. Hope you're making trips and vacation plans. It's so important for our mental health and sanity to begin physically reconnecting with one another. We have been in such a blah, blah, blah space for far too long. But of course, remember practicing safety for one and all during our collective life in the time of coronavirus. We're all still officially in a pandemic state. Cannot wait until it's over. But thank you for listening in on today's episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.